I hope you're excited. Are you excited? You gonna have fun? Most importantly, have fun, because this is an opportunity that is unique to California. It is the senior event that we have here in our state, and we will be talking about some other things that are coming up later on in the year shortly. That was my teaser. I asked Lori not to do the traditional biography because those of you who know me or who are getting to know me know that I seldom do what's expected. And I know as a speaker that they go through that, you know, she went to college here, she's been in healthcare 150,000 years, blah, 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 blah. That embarrasses the daylights out of me, and I know for some speakers that to hear that's very exciting. If you heard mine, it would be very boring. And I know that's really not what you're interested in. So I asked Lori not to do that, so that's our first untraditional thing that we're doing this morning. The second untraditional thing is I don't use PowerPoint. So as a keynote speaker, my role is to inform, inspire, and prepare you for the events ahead. And so your preparation is to hone your listening skills. So reach for your iPads, reach for your pads of paper and your pens, and hone those listening skills. Because even with PowerPoint, you wouldn't catch all the things that I'm probably going to throw at you very quickly. I will try to slow down at those points where I would be taking notes if it were me. So who am I? Well, I have not quite spent 150,000 years in healthcare, but sometimes it feels like that. I come from a family where the family business is healthcare and the military. And so I spent many years learning healthcare, wearing a uniform. I was a U.S. Navy corpsman, and for those of you who don't know what that is a first-line, front-line trauma specialist with the U.S. Navy and the Marine Corps. And it was an incredibly challenging and wonderful learning experience. And obviously, I was one of those folks who had to document in medical records. I won't have the time this morning to tell you the full story that Lori teased you with, but I will be happy to do that with you a little bit later, about the first time in 1983 that I saw 83. Yeah, she said 83. Saw the potential for electronic data and the impact that could make on patient care. Now, let me take you back for just a minute to 1983. We didn't have iPhones. We didn't have internet. The IPP address protocol had just been approved in 1982, but nobody really knew what the internet was. Well, maybe Dr. Kaiser knew what it was, but I certainly didn't know what it was. We didn't have cell phones at all. If you were really, really, really important in your organization, you had this really cool IBM Selectric typewriter that had these round balls that you could pull off and change fonts. So seeing a vision and getting to understand what the potential for that electronic data transfer was really it was groundbreaking, but it was due to my experiences in the military, and as many of you know, a lot of our electronic stuff comes from there, and I'm very proud to have been part of that. So I spent about the last 30 years of my life in healthcare working on health information management. Now, you don't have to do the math. I'm 55 years old. I've got more gray hair than I had 5 months ago when I started this job. But I come from healthcare operations in a clinical setting. I'm not going to run for public office, ever. So I'm not here to solicit your vote, but I am here to tell you that this is such an important time for us. I have been passionate about health information management. It wasn't even called that when I started my education in it. It was called medical records. I went and got a degree in the science of medical records. Science and medical records, people get degrees in that? Well, yes, they do. I'm a nationally registered health information administrator, a little bit different skill set than my predecessors in the role brought, because I'm not smart enough to focus on the technology. We have brilliant people in this room, Will and Bill and Rim, and people you don't even have to say their last names and people know who they are. They are brilliant, and I don't want to go on because I'll leave people out, at the technology of the tool that we're talking about. My role has always been the use of the data, regardless of how we got that data, what the tool was that held it. So I bring to this new position probably the most politically incorrect personality in Sacramento. My comments today have not been approved by anyone. I live in the belief that every day I'll probably lose my job because I'll say something I shouldn't have said. But I have been very, very fortunate with my background and my education to be approached and be asked to fill this role, and I am delighted to do so. I'm delighted to be here with you today, although I promised I wouldn't be effusive in thanking you. I really want you to have a good time. I had two predecessors, one of who's with us today, Dr. Lynette Scott. Both of them had different times than what we're living in now, and both of them had different challenges than what we're facing now. Lynette is an amazing woman. She agreed, think about this for a second, now, she agreed to step in as the interim deputy secretary and maintain her other full-time job in government. Amazing, and she did a phenomenal job. So please join with me in thanking her for the work that she did. So what's different now, and why me now? The deputy secretary previously was called the deputy secretary of HIT. And one of the challenges that Jonah, there's another person, we don't even have to mention their last name, try to follow in all these shoes. One of the challenges he had was he had no staff. The deputy secretary stood alone within the Department of Health and Human, or the Agency of Health and Human Services for the state of California, and it was really challenged. Lynette had no staff. So part of what happened when they looked to fill the position with a permanent person was that they looked to make some changes to help mitigate some of the barriers and some of the problems that we have had in California, challenges in moving HIE forward. So yes, okay, here's my official title if I can get it right. I'm the Deputy Secretary, Health Information Exchange for the California Health and Human Services Agency, and I'm also now the director of Cal OHI, which, as you know, is the California Office of Health Information Integrity. Just call me Pam, please. I have another role, not a title, but a role. I'm also the state HIT coordinator for the health and for the CMS and ONC grants, the cooperative grants for HIE. I'm very confused most of the time, but I have been very, very blessed with a dynamic staff. I left the room last night from the community of practice by design because I wanted you to have the opportunity to meet with some of the dynamic people who now staff the department, the Office of Health Information Integrity. I'm going to introduce you to two of them. I have asked the rest of them to scatter around the room so that I will recognize them, you will see them, and you will feel approachable and have the ability to talk to them. When I started in this role, about half of the positions in Cal OHI were vacant. So I've had the opportunity to bring a lot of new faces to you. And I've brought a lot of them here today because they are new, they are young, they're getting their minds around this idea of health information exchange, and many of them have not had the opportunity to see it. So please welcome them, and please share encouraging and positive words and kind words with them, because I have never worked harder in my life than I have worked in the last 5 months, and they have stood right beside me, encouraging me, and we would appreciate your encouragement. So let me introduce you, first of all, to the Assistant Director of Cal OHI. He's known to many of you from his work previously at the state of California. He was with OSHPD. He was with the Department of Public Health. He left state service and became the manager for meaningful use and health information exchange for Adventist Health, Scott Chrisman. I wouldn't have taken the job if I didn't believe that Scott would have been there to help me, because he knows things I don't know. I don't know how you get things done in the state of California, but Scott knows that. And so he'll say to me, don't worry about this stuff, this budget and people and HR stuff. You go be the deputy secretary and I'll handle all this. Thank you. The second person I'd like to introduce you to, some of you met last night at the Community of Practice. She's a dynamic young woman who is the branch chief for e-health standards and policy. Now what that means is she's responsible for the privacy and security standards that are being developed and will be developed in the future out of the Office of Cal Ojai. She understands on a very personal level the importance of having data and information to make decisions, because she has a long, in-depth background in policy. Not very long, because she's not that old, but she has a deep background in policy. But she's also the mother of 5. So she knows about making decisions based on information. She's very technically wired because of that. She's got to keep up with where those kids are, what they're doing, and what they think they're going to be doing. And so it is my pleasure to introduce you to Cassie Mctaggart. Cassie? And now I'd like the rest of the Cal Ojai staff just to briefly stand up and wave, and they are scattered all around the room. Some of them are known to you, some are not. See, there's a lot of us now. We can help you a lot. Now, if you're fortunate enough to get one of Cassie's cards or Scott's cards or one of my cards, you're going to find on the back of it some very important information. And one of you is going to find the information placed on the back of your card upside down. So you really want to get one of these cards, because we have a little surprise for you if you're the one that gets the upside down one. But what's on the back of the card is really what we've been working on. I know, how hokey, right? Well, it's me. So what's on the back of the card is the new and condensed version of the vision and goals of California eHealth. We call them the California Health e-goals, and when I say that really quickly, my staff thought I was saying eagles. And so they now refer to them as our eagles. The vision is, very succinctly, to improve the health and well-being of all Californians. And California's health e-goals are enhance, ensure, and engage. We're going to enhance individual and population health outcomes through results-oriented programs, ensure secure data access that protects patient privacy and data integrity, and engage patients and families as partners in care. Doesn't that about cover it? So grab a card, you'll have our contact information, we want to hear from you, and you'll also have just a pocket version of the vision and goals. Our mission has changed. We are about the business of health information exchange. We are not in state government to say no. We are not in state government to create barriers. We are there to get the barriers out of the way. I'm an operational person. I know this is important. We need to make it happen. And if you have not had an opportunity to read our newly revised strategic and operational plan, looks like this if you print it out, it is on your thumb drive. We have a requirement to review and update our strategic and operational plan on a regular basis, and so we took this opportunity to meet that requirement, even though we are in a transitional period with that plan. I want to thank you all for your kind words. Those of you who've read it. Who reads a government document, for Pete's sake? It's 168 pages long, but it's really designed to be an easy read. Our #1 hit on our website at Cal Ojai, and also at the website where you will find this and other information about your life, which is ehealth.ca.gov. There's a note-taking opportunity for you. ehealth.ca.gov is where you will find another copy of this, as well as regular updates from us. Those of you who've read it, I thank you so much for your comments. And one of the comments was, it was a pretty easy read. And it was very different. It is the #1 hit on our website. Internationally, we have people coming to our website looking for California's strategic and operational plan. It's not written in technological language, because I can't read that stuff. It is technical where it needs to be, but it's going to talk about where we've been, where we are, and where we're going. So if you want to know more about the plans of how we're going to approach the future, some of it will be in here. We are asking for your comments to be submitted to us through our website. There's a document on there, and that comment period is open till August the 9th. It's really your document. I started it, the staff started it, we took a stab at it, it's out there for you to review. Please do so. It's important. The other website that you can use to keep up with us, although it's not as rich in HIE data, is ohi.ca.gov. That's the other one that you can use. I want to talk a little bit about our HIE cooperative agreement. I don't want to bore you, but I do want to hit some of the high factual points before I get into the storytelling. We have 6 areas that we are required to address in the cooperative agreement. And you're going to see those delineated in the plan when you read it. Ensuring a trust environment, monitoring HIE adoption, facilitating HIE expansion and acceleration, supporting meaningful use, and communications to the public and providers. There's also a 6th one, which is operations, and that has to do with the internal business operations of how we do that. But those are the things from an HIE perspective that we have focused on and will continue to focus on while we transition. We are at a place where we can write a new chapter. I bring a new flavor. And we have learned a lot of lessons over the last 3 years under this agreement, and it's an opportunity for us to write the next chapter. And we have taken this opportunity to find a new partner. As you know, Cal eConnect was our state designated governance partner. And they have informed us that they would like to no longer have that status as of the beginning of September. And so we have found a new partner, and Dr. Ken Kaiser is here representing the new partnership today, and he's going to talk to you a little bit about his vision as we go forward and actually focus on outcomes-driven decision-making and quality through the use and tool of HIE. But we have programmatic work to celebrate. You have worked very hard. And 3 years into a project is a long time. And I know you're frustrated and you're discouraged and you're thinking we're never going to get there, and we seem to just keep hitting missteps along the way at times. So I'm here to say to you, do not falter. Keep working. Encourage each other. I'm a cheerleader for you, but you have to be cheerleaders for each other. Do not bring skepticism and doubt. You have worked hard. We need to all continue to work hard to move this thing. It is about the patients, and unfortunately, we all are experiencing family situations, many of us, or personal situations as we age that are making us be patients or support people for patients, and we cannot lose sight of why we are doing this. But our celebration should focus around things like HIE orderable kit that I refer to, much to the dismay of my professional communications colleagues, as HIE OK. And if you do not know about the orderable kit, there are people in the room like Rem, Bill Behe, and others who will tell you about the collaboration between the EHR vendors and the state partner to develop HL7 standards-based interoperability modules or kits to help providers attain HIE capability. Sound intriguing? I hope so. That's really about all I can tell you about it. Technically, no, that's not really true, but I'm not going to tell you that right now. If you want more information about HIE OK, please see Bill or Rim or any of the Cal eConnect team members who've been working on the programmatic work. The second round of HIE expansion grants is out there being reviewed. We're in the process of issuing additional grants. One of our commitments while we transitioned was that we would not slow down the programmatic work. And this has been such a dance, I can't even tell you, to be moving and keep going, to be moving sort of sideways and keep going forward, whoo-wee. I truly have never worked so hard in my life, but it isn't about me, and that's okay. So by the end of 2012, the goal of the expansion grants is that 75% of the counties in California, 75% of the counties will either have community-based operating HIEs or will be in the planning phases. Now that's a huge amount of space to cover. If you take the United States map and you fold it in half, and you look through the map at the amount of the East Coast that the state of California covers. I don't know if any of you have ever done this. This is the kind of stuff that entertains me. California goes from Florida to Delaware, yet we are one state. Cool. We've learned a lot of lessons through these 3 years. We've learned again how very big we are. We are also dealing in our programmatic work with the challenges of community-based versus enterprise HIE. And I hope that you, I'm sure all of you as HIE professionals know what I'm referring to when I say that, but we have a gap in California being created that separates community-based HIE efforts from the private enterprise or integrated health system HIE efforts. We have got to figure out a way to bridge that gap. So there is still work to be done. There's still a lot of work to be done. We have also realized over this 3 years more, thanks to Lynette's work, about the challenges we face in HIE within the state government. And we have looked at a population, a condition, and an event in our use case scenarios. We've looked at, and through looking at these, we've created what our federal partners challenged us to refer to as audacious goals. That sounds like something California would come up with, but we didn't. They did. And so our audacious goals in California are going to center around foster children, providing complete health records for foster children. Foster children are 100% Medi-Cal in our state. About 80% of them have behavioral health issues, including mental health challenges, and 90% of them take more than one medication. Imagine the benefit if we could create complete medical records electronically for foster children. Our condition was chronic care, and it was reducing the complications of stroke, and we realized there was tremendous potential in managing post-acute stroke care and prevention of future strokes. And then our emergency care case use, oh, here's a surprise. We looked at a catastrophic earthquake. And what can we do using HIE to continue to provide care under conditions of a catastrophic earthquake? It's not if it happens, but this is California. When it happens, it's going to happen. And we have a resource that can be of tremendous value. So you are the stakeholders. The general public is the stakeholders, and we need to hear from you as we move forward. So out on the table, you found a card that talks about a save the date future event. We printed these cards while we were still planning, and so here's another opportunity for note-taking. You want to save the date, Thursday, November the 1st, when we will have our HIE Summit in Sacramento. And we want you to come. We want you to participate in the breakout sessions. We have decided, since we printed the card, though, that we're going to add half of a second day of speakers and discussion, and then in the afternoon of the second day, November 2nd, there will be opportunities, room and space available for you to hold meetings of special interest groups. So if you have a committee, a work group, or another group that needs a place to meet, and a lot of you are going to be in Sacramento anyway, I hope, that'll be a great opportunity for you. So this will go November 1st and the 2nd to about 3 o'clock. Expanding the role of this summit is exponentially complicated and expensive. And we, like Redwood MedNet, will be looking for sponsors. If you are interested in being a sponsor or want to talk about how to help get sponsors, Scott will be happy to hear from you. And when you exchange cards with him, we will get in touch with you. But save the date. Save the date. And I'll tell you, Dr. Kaiser has he's a big thinker. He's got some really great ideas. He said to me the other day, so like big speakers, important speakers, who are you thinking that you want to have there? I said, you're the most important guy I know, but he knows everybody. Because I'm going to introduce him in just a moment, and you're going to know why he knows everybody. There are going to be other opportunities. In addition to commenting on the state strategic and operational plan, there are going to be other opportunities in the months and weeks ahead for you to provide your input to us. You know that Cal Ojai has been working for some time on a law harmonization project. We have work groups that have been now working under the direction of Cassie to put together law harmonization language and law harmonization concepts. Those are also on your thumb drive, along with a security toolkit to help providers and others assess their security needs and compliance, which is part of meaningful use. But there's an elephant in the room. And I know there's an elephant in this room, and it is the one that has plagued us in California for years, since it first came up and we really started having serious conversations about HIE. And I am not afraid of elephants, and I don't want you to be either, because we will eat this elephant a bite at a time. And the elephant is the issue of consent. And I know last night in the community of practice that there was a buzz and people wanted me to stay so they could confront me on what my solution for consent was going to be. And I don't have a solution, except that we have authority. We, Cal Ojai, under legislation and regulation, has authority to have demonstration projects of alternatives, is the word that's in the language, alternatives for consent. And I will tell you, I will promise to you that we will look at alternatives to consent in California. I heard this week that the demonstration project that is testing opt-in, they do not want to provide their evaluation to me, because they are afraid if they provide an evaluation of the demonstration project, since they were the only one and it was only opt-in, that is the only option that we will look at. And I can assure you that is not the case. I am looking for empirical, outcome-driven decision-making. We will be looking for people who are interested in demonstration projects for other than opt-in. I cannot tell you what the selection will be when we have the final evidence in on demonstration alternatives. But I can assure you, we will not shove down your throats, as someone said to me last night in their verbiage, we will not shove down your throats only one option for consent. That is my promise to you. I'll need you to work with me. We'll need to find out what the options are before we move forward. And we will also work very hard with you to harmonize our laws to make them less complex and less of a barrier to you. So what do we need to do now? We need a renewed focus on the goal. The goal is the patient. The goal is the care. We need your enthusiasm. We need your positiveness. We need your dedication to the work at hand. My staff brings that. I hope you bring it with us. We need creative solutions. We need nimble spirits. Things are changing. Stage 2, meaningful use, final regs just went to the Office of Management and Budget this week. Things change. They change as we're working. We're shooting at a moving target. We need to be nimble. We need to have positive spirits. And we need kindness. This work is hard. Don't beat yourself up. Don't beat other people up. And I'm going to conclude with a very short story before I introduce Dr. Kaiser to you. Many of you wondered when you saw the announcement that I had accepted this position why I did that. And many of you, without knowing me, said, obviously, she's crazy. Well, that is true. I am a little crazy. I have a little quirky sense of humor, and I like to have a lot of fun. But a week before I was sworn into this position, my father died. And he had fought a valiant and hard battle with prostate cancer. And I had the opportunity to spend a lot of time with him over the 18 months that he allowed himself to be participants in trials and pioneering treatments for prostate cancer. Now, he had been a critical access hospital administrator. I'm from one of the most remote parts of the United States, and quite frankly, if I had my wish, that's where I'd be all the time. But he was a nurse. He had been a military medical provider in his youth. He was very young when I was born. He was my best friend. He was my closest confidant, and he was the person who could most quickly yank me up and give me a reality check when I needed one. So 3 weeks before he passed away, I had the conversation with him, and I said, Dad, they've asked me to take this job, and it's big, and I'm scared, and I don't know if I can do it. And he was in the hospital, an acute care hospital, qualifying for his 3-day stay to go into terminal nursing care at the end of his journey. And he said to me, now I'll probably tear up, I always do, but he said to me this: yes, this is a big job. This is healthcare reform. They can talk about money, they can talk about payment. This is healthcare reform. As the provider in the emergency room, I can tell you, as you have told others, that having the patient information there when we need it is what is going to reform and transform healthcare. Yeah, it's a big job. And of course you're scared. And now I'm going to say to you what he said to me. But you have spent your entire life preparing for this moment and this time. And if not you, then who? And I said, but Dad, this is scary. I could fail. He said, what if you fail? You will fail if you don't try. And you will fail if you try and you don't get where you wanted to be and you didn't learn the lessons that you needed to know. So you do this. You make this happen. You make this happen for California, because when you make it happen for California, you're going to make it happen everywhere. So I made a promise to a dying man who said to me, don't be afraid to fail. It is a big job. This is the most important thing healthcare has ever faced. And 3 weeks later, he was gone. And a week after that, I was the deputy secretary. And I don't tell you that to be dramatic, but I tell you that because that's what a healthcare provider who had spent over 45 years in healthcare, from the time he was 17 years old, believed was going to change healthcare. I hope you believe that too. If you don't, look in the mirror and say, if I were the patient, would I want the information available? And I know the answer is going to be yes. So, if not you, then who? We may fail, so what? You have spent your entire lives getting to this point. This is important stuff. And I'm delighted to introduce to you a new partner who's going to help all of us with that, who's going to help California get there, and who's going to make my dad so proud of all of us. Dr. Ken Kaiser is known to many of you through his work over the past years, both with the California predecessor to the Department of Healthcare Services. But I'm going to tell his story probably much more relaxed than he would, because he's a very big thinker and he's a very serious man. But I will tell you that he was asked in the 1990s by President Clinton to leave California, come to Washington, because hospitals were being reported on relative to quality and performance, and the VA hospitals were the worst ranked hospitals in the country. Now, Dr. Kaiser doesn't usually talk about it, but he's also a Navy veteran like Lynette and I, and it is a small club, and we do take this stuff really seriously, and we do care about veterans. So he said yes, and he went to Washington, and the rest is history. They have the leading electronic health record system in the country, and he doesn't talk about this stuff, so I'll just tell you. That was Dr. Kaiser's work. He also formed the National Quality Forum and some other things along the way, and now he's back in California. And when I literally cold called him and said, would you have a conversation with me about health information exchange in California? The phone got very quiet, and I thought, oh, this is not good. And he said to me, sure. we can talk. And we did. So he is now at, I'll mess it up, I mess it up every time. He's at the University of California Davis Health System Institute for Population Health Improvement. And he's going to help us improve healthcare by applying health information exchange. Please join me in welcoming our new partner in health information exchange, Dr. Ken Kaiser.